coronavirus. It's going to disappear. One day it's like a miracle. It will disappear.
So this is the virus segment. We reached the most horrible milestone ever with 500,000, 500,000 people and counting who are dying from COVID-19. Such a horrible milestone. But I mean, it does feel like maybe some light in the tunnel. Maybe 500,000 people are finally realizing that to take this seriously, and like the vaccine rollout is slowly calling out, but at the same time, the disparities within that, in the same way, disparities in who was dying from COVID-19. So, who's dying the most from COVID-19? People who have to go out there and work like there's no coronavirus. So all over the world, there's people just living out their lives, working just with a mask. They don't have a choice to stay home. So, I really want to share this like crazy thing. Go ahead.
Let us also point out that we're still only 5% of the world's population for 500,000 deaths.
How does that make sense?
And like, how does it make sense? It's the culture. It's the culture of my personal freedom over your right to live. And I'm going to do whatever I want because I want to do it. And I don't care about the consequences that other people may have to pay for what I want to do because America.
And speaking of consequences, I mean, we have, America historically has been like doing all kinds of strange experiments on Black people. I mean, I don't want to go down the list of what strange things they were doing even before, people who weren't doctors were doing, the people doing slavery time and all kinds of stuff, till like the Tuskegee experiments. We can go for days in the weird things Black people. So of course we're not trusting what's happening at all, and it's showing in the stats, completely shown in the stats. And we're going to share this screenshot with you. Michigan is finally one of the few states. Mind you, Michigan was the state that the guys were planning to kidnap the mayor. To kidnap the governor.
They stormed the state building when they broke in with the weapons. Yeah, that was Michigan.
Yeah, so at the same time, Michigan wants to add the race data to COVID-19 vaccine dashboard, and I actually have the dashboard I'm gonna pull up later. But I just want to, because just to see the dashboard really talks about we said that the regime is like, even though Black people are like the small percentage of the United States population, somehow we have the highest death rate, and at the same time the lowest vaccine rate, even though we make up such a small percentage of the population. And just to see it visually, people kind of understand that ratio when it comes to like police violence, when it comes to like all the different inequalities, why there's so small amount of people, their stats are so high. You have to really see it visually, and the dashboard really shows it.
Maybe that's why the white people were storming the state building. They're like, well, it's going to be the Black people that's dying from it. Why can't I go get my hair done? Because it's not going to kill me the same way it's going to kill them.
Yeah, they're doing my hair anyway. So this percentage right here, 43% of people didn't even put their race in it. That's because people just running there, trying it out. Don't care what color they are. Barney up
or maybe they don't want to be chalked up like that,
Barney.
There are certain forums that I look at, and they put race on it. I was like, what the fuck you need to know that for? I just skip that shit.
Like, are you gonna I'm not gonna get a job if I tell you I'm Black? I'm not gonna put, and that's what it feels like, So you see this crazy stat, but at the same time, 41%, almost 42% of white people have gotten the vaccine, comparatively to only almost 4% of Black people in Michigan got the vaccine. And
it does kind of make me think that the vaccine just might be safe, because you see all of these white people, and a lot of them affluent, that are even posing as old people to skip places in line.
I saw a TikTok I see TikToks of like white people pretend to be old on the line and say old things, like, I used to like store my Kool-Aid with a wooden spoon and like kind of shit like that.
Did you hear the word whippersnapper?
Whippersnapper. Wear an onion on my belt. Used a nickel to get on the trolley. I need that vaccine, So all kinds of crazy things. I saw this video on Twitter of like I think it was in Washington Heights. I don't know if you ever walked around Washington Heights and see how many white people you see there on a normal day.
Oh,
But this,
nah, because my default is I might get stabbed while in my car with the windows up.
but this particular day in Washington Heights, there was this long line around the block of white people in Washington Heights.
Did they have bulletproof vests on, stab-proof shirts?
No, they had their Crocs on and and their Birkenstocks and stuff like that, and biting.
They
stickers.
would do that. They would do that in 20-degree weather, right?
Exactly. They were out there in Washington Heights. Like
I want to apologize to the audience. That sounded like mad racist.
Yeah, we're gonna get Matt or whoever comes in the chat is gonna say we're racist just because we said
yeah, and I'll deserve it. I'll deserve it. I'll eat that one. Yeah, I'll eat that one.
But but at the same time, everyone's saying the same thing. We want people to have all races to have access to the vaccines. Are poor. It doesn't matter how poor you are, how rich you are, for us to reach herd immunity at some point, so we can have a normal life and not go nuts in our houses, scratching the walls in May. That we need people to wear a mask continually, and we need this kind of vaccine rollout to happen. And so far, it's happening, but it's only happening to one demographic in Michigan. We show you an example here, but you can go each state and pretty much it's the same pattern. And I want to share this next, like I talked about, the visualization of it. Like, what do you mean that? How do the small percent of the population of Black people be affected so I don't get it. I need to see it. So that's what's great about this thing. This kind of news, it may seem like it's like, oh, it's boring news, whatever. But like the fact that like how long it took for us to like get people, for the police to like record they're killing people, that hasn't been happening for years. It wasn't like a police counter of them killing people. They were just killing people willy-nilly for decades and not counting it. The FBI finally decided to do it.
Only when we got the cell phone video did the FBI force them to start tabulating that data.
Yeah, so that's when you see these numbers, then that's when your reality actually becomes validated. Look, people have been saying this for years, and now we have the statistics.
I had a black man who's one of those MAGA heads.
Yeah.
He tried to challenge me the other day by asking me what systemic racism is.
Yeah.
And just sitting here listening to you talk about them releasing the demographic breakdown of those who've been vaccinated, those who have been infected, those, severely impacted, et cetera, et cetera. And I think about how the virus isn't just killing Black people just because they're Black and they've got more melanin in their skin and they're attacking the melanin, the melanocytes.
Yeah.
That's not what's happening. What we're looking at is a system that is built against Black people that more often than they should guarantees a negative outcome. So when you're talking about becoming infected with the virus, well, what quality of the food do you have access to so that you can build up the kind of immune system necessary to fend some of it off? Some of the quality of the medical care when you are transported by when you're transported by the EMTs. Do they treat you with the utmost care, the way that they treat other people? When you get to the hospital, do the doctors and nurses treat you with the utmost care? Yeah. So,
exactly, and like we talked about it before the show about a good example, a good like segue to be talking about like rare diseases, and I talked about how Lorenzo Mourning had a rare disease, and the fact even an NBA player in the highest level played for like 3 months. Almost like 3-4 with this rare kidney condition that if you didn't spot that, he would have been even worse off. And the fact that even him in the highest level, when he gets like checkups, he has to get checkups every day, like he's like a Ferrari car. He gets checkups all the time, and they realized the chemical condition of his body, and even that level, they didn't know what was going on. They had to keep testing because it was a rare disease. And that's because he was a super duper NBA player that had access to the highest level of medical science.
If it was me, I'd just be dead.
Yeah, exactly. If you got found with that rare disease, they'd be like, oh, maybe I don't know, take an Advil. I mean, like, I don't know, drink
Nah,
some
they
water.
say take a nap in this hole in the ground.
Drink some water and take a nap. So
Now we'll pour the water on you. We're not going to waste it in you. The trees need it. The trees need it when
the
they use your
worms, the
body
trees
for
need it.
nutrients. You
So,
want to talk about being vegan? The trees ain't vegan. They eating you when you're done. It's over.
So that's the thing. It goes back to you saying, like, if you went to the doctor, how are they going to see you as a black person? They're going to see you someone who's actually sick, or someone just making something up, or like they can think you're eating fried chicken at a time, and really you're actually a really someone who cares about your diet. How do those people perceive you? And then each stage of that, what kinds of things happen. But back to the data itself.
Well, you're trying to say that because I'm black and I care about my health, that I'm not going to eat fried chicken? Is that what you're saying?
They were like, oh, they eat fried chicken. That's a heart disease. I go for walks for fried chicken sometimes.
You go for walks with your fried chicken? You walk your fried chicken on a leash?
Yeah, walking. Yeah, that's where you get the best hot sauce. So
yeah, this segment is definitely going down the tubes.
I mean, we gotta talk about something funny because we're about to press this button right here. So we see cases here, like, okay, we know that Michigan, white people are a majority population in Michigan, so their cases are gonna be the highest per million. But at the same time, black people still have the highest cases, even though they don't make up as much as the population. So you see this kind of example in the stats, like how is that they have the least amount of cases, but proportionally they're affected the most, as you see in this example here. And then you want to switch to deaths, which is even sadder. So you have right here, white people are dying. I mean, everyone's dying from the coronavirus. But at the same time, black people are dying way more disproportionately within a smaller population. And you see this in Michigan as well.
So the
stats show it. I mean, white people.
So the murder rate in Chicago has nothing to do with this? Is that what you're trying to say?
I mean, that's what the next segment is going to be about Chicago getting the guns off Chicago streets and stuff like that. We're going to eat the black on black crime.
No, because, anytime you mention anything that black people are struggling with existentially, they always want to point to the murder rate in Chicago as that somehow erases.
The strip club.
So, we're dying. Fathers. Yeah, so we're dying at higher rates from the Rona. You want to talk about the murder rate in Chicago? You want to use that deflection tactic, maybe, perhaps? Because it's totally inappropriate, but you could try to make it work. You try to stretch that out.
Yeah, just gaslight the conversation, talking about some.
Yeah, blow that shit up. Michael Bay style.
Talk about zoot suits. We wore those zoot suits back in the day. No wonder there was so much crime.
I should buy a zoot suit.
You can go to any era and some old crusty guy saying some bullshit about, like, oh, black people, it's their fault wearing all those zoot suits.
What kind of zoot suit what color zoot suit do you think I should wear on the air? I mean, you're not going to be able to see how zooted it is.
I was gonna say some, like, who framed Roger Rabbit crazy shit. Like,
oh yeah, that's what I was thinking.
Like some sharp ass shoulders, like, like with the big hat and the feather,
the mask.
Yeah, you go to any era, like whatever bullshit people come up with, the blues. That song is make black people really sad and go commit crimes, like whatever, man. Like, so, but these stats show it, even though we make up less of the population in Michigan, somehow we're dying the most amongst ourselves. And then the vaccine rate shows that we're not being vaccinated as much either, because
we already know why. There's not a whole lot of trust.
Yeah, exactly. So it's like this. It's like being caught in a hard rock, and it's like crazy situation right now. It feels like it's really kind of stressful being black.
I do feel like I'm getting close to that point where I might consider, getting, the shots, because I'm looking around. I'm not seeing widespread reports of, people, being fucked up.
You're not seeing someone turn it into the intro video of the virus segment.
Yeah, I don't want to see any like fucking bubbly, boiling shit underneath my arm,
Yeah.
my forearm, the skin of my forearm.
Or maybe you might shoot lasers at your eyes. Maybe that might happen.
I mean, you know, like when my partner got the laser eye surgery, that's what I wanted to happen. I was like, yo, if you don't get any superpowers from this shit, it's fucking worthless.
So that's the virus segment. You know, I guess we got it's a crazy situation right now in the world, and hopefully everyone stays positive as the weather gets a little warmer. Day by day, the days get a little longer day by day, especially people in Texas. You know, we have like producers in act.tv who live in Texas and right now, and just like hearing the crazy stuff happening there is just like crazy right now in Texas. Like they lose power. And we're gonna have a segment about that next if you stay tuned. But in Black Power Magic Hour, you can follow us on social media on Twitter, Facebook, and YouTube and Act TV. We have over 47,000 subscribers, and then check Dr. Virginia stream. He's live all the time, or everywhere on YouTube, Facebook, Twitch, Discord, whatever. I mean, I don't know, mind reading powers. Who knows what next social media platform we're gonna have by the end of the year. So that's the virus.